Welcome to the Milk Making Minutes. I'm your host, Lo. This week, I'm thrilled to share a story of struggle and triumph, told by a mental health professional who had trouble seeing her own mental health struggles while in the thick of postpartum depression. As you listen, think about your own breastfeeding journey and the impact it might have had on your mental health, and what feeling confident with breastfeeding could have done to improve your mental health in those early postpartum days. Enjoy this conversation filled with deep insight and vulnerability. Hi, Jess. Welcome to the Milk Making Minutes. I'm so glad you've joined me this morning.
Yes, thank you for having me. I'm very excited to share my story.
Yeah, so before you do share your story, why don't you introduce yourself and your family?
Sure. So, my name is Jess Pettit. I am from Wilbraham, Massachusetts. I have a wonderful husband, Peter, and I have a 5.5-year-old daughter, Zoe, and an 11-month-old little boy, Luke, and he will be turning 1 next week.
Oh, wow. Happy birthday to him. One such a big milestone.
It is a milestone. Yeah.
When I asked Jess about her exposure to breastfeeding before starting her family, she described an array of experiences. As a mental health professional specializing in working with women trying to conceive, she had worked with many patients, both bottle and breastfeeding their babies during sessions. She had friends who had exclusively breastfed, exclusively formula fed, and even one friend who exclusively pumped for 2 years. Jess described feeling an immense pressure to breastfeed, both from external sources like the hospital care providers where she gave birth, and from her inner voice telling her that is what breasts were for. She's had time since then to process her thoughts about that. This is what she said.
But yeah, it was interesting because working with clients, I'm like, do what you need to do to feed your child and don't feel shameful if you feed them this way and don't feel shameful if you feed them that way. But then, like, I had my own internal struggle of I need to breastfeed my baby and that is that.
Mm.
Yeah,
hmm
it was a very interesting conflict I had.
We don't want to feel ashamed when it doesn't go the way we hoped. And it's okay to grieve those lost experiences because it's a part of being human to have a hope that things will go one way, and if they don't go that way, to be sad about that.
Yes,
You know,
totally.
both things can exist.
Yes, and I'm so glad that you talked about that because like it's not talked about in society and it's we have to just keep our mouths shut and be grateful for what we have, but it is such a grieving process. And as society, people, don't deal with grief. Anyways, so
Mm. Yeah.
no, yes. I
Yeah,
totally
for sure. Yeah. Okay, so you had hopes that it would work for you, and you felt a little pressure, both as
yeah.
from the hospital and just internally, that you would breastfeed.
Yes.
Jess took what she described as the silly little breastfeeding class at the hospital. With the hindsight she has now, she felt like it did not prepare her at all for what was to come with her very challenging first breastfeeding experience with her first daughter.
I had Zoe in the hospital and we tried breastfeeding. She was small. She was, oh gosh, almost 6 pounds. So she was in the 5 pound range. I had not a great experience at all in the hospital. Hence, with my son, I had a home birth. And so I had her vaginally. I wanted her in a tub. That didn't happen. And we we attempted to latch, and it was the most excruciating, besides giving birth,
Mhm.
excruciating pain. It was awful. It was awful. And it was awful. And
From the very first latch?
oh yeah, from the get go.
Okay.
And my gut instinct, which is my intuition is normally pretty good and accurate. My gut was telling me something was wrong.
Mhm.
And I was crying and crying in the hospital. And I kept telling the nurse, something is wrong. It's not supposed to feel like this.
Mm.
And they kept dismissing me. I was dismissed and dismissed. And it said, this is normal. You just need to push through it. And I kept telling them, no, no, something is wrong. I want to see the lactation consultant. So
So how long was it that you were experiencing this pain and that you were being dismissed?
until I saw lactation, 2 days.
Mm.
And in the meantime, they were bringing in the pump and then they were formula feeding, even though I didn't want them to formula feed because, like, I knew I had milk to offer, colostrum.
Mhm. Mhm.
And so finally, I think it was like day 2, I was able to the lactation consultant came in, and she it's all a blur. She was wonderful. She helped me set up a pump and my nipples were like destroyed. They were all
Mm.
like I didn't even want anyone near them. So she set me up with a pump and a hospital grade pump, which I will tell you makes a world of a difference. And then from there, once I was released from the hospital, I met with her. She was just a godsend, an angel, so amazing. Me and my husband met with her 1 to 2 times a week for 3 months.
Mm. Do you remember her name?
Victoria Foley,
Mm.
she
Mhm.
is just amazing. And she would sit, I'm going to get all emotional about it. She would sit with me and she would just let me cry and she would just be patient. And she knew I was so adamant about breastfeeding that she worked with me. She didn't ever push formula. She never pushed her opinions. She always just followed my lead because when I was pumping, I was an oversupplier, so I knew I had a wealth of milk to give.
Mhm.
So I didn't want to stop because I knew I had so much. So she worked with the latch and she worked with a plan and she worked with healing my nipples. She was just so wonderful. And I actually still talk to her to this day and we call ourselves breast friends.
Aw.
Yeah. But then what really saved me is I had a doula for Zoe's birth and she's just fabulous. She was also the doula for my son's birth. And she was going to school as a naturopathic doctor. And she came for the postpartum visit. I was crying and I was telling her that breastfeeding was not going how I planned, how I hoped. And she asked if Zoe had any ties in her mouth. And I said, I don't know. So she looked in Zoe's mouth, and Zoe's mouth was loaded with ties. So she then referred me to the wonderful and magnificent Dr. Shamey, who is a pediatric dentist who lasers lip mouth ties. And we brought Zoe in at 3 days, I think it was 3 days old. And Dr. Shamey looked in her mouth and she had 8 ties that needed to be
Mm.
revised. So basically, this little girl, this little baby, couldn't open her mouth to latch appropriately.
Mhm.
So we got her revised and we did all the excruciating, awful exercises that you have to do to make sure they don't grow back or reattach, what I mean. And then I had this hope that because we had her revised, that then breastfeeding would magnificently, like magically get better. So I attempted to latch again and it didn't go as hoped,
Mm.
planned.
Jess goes on to describe the various ways they were feeding her baby Zoe. They initially used an SNS tubing system attached to the breast, but quickly transitioned to exclusive pumping and bottle feeding due to the severe pain she felt while breastfeeding. Although Jess felt fully supported by her IBCLC and they are great friends to this day, we wondered together why her baby was not evaluated for tongue tie sooner. Sometimes hospitals have policies preventing providers from mentioning tongue ties, which puts those providers in a terrible predicament. We do not know if that is the case in this instance, but it is something to be aware of when working with a hospital-based provider. Jessica was disappointed to discover that after having the tongue ties lasered, it did not result in immediate relief of her pain. This led to a dark time in her life that she wasn't prepared for, even as a mental health professional who had helped others walk through very similar periods.
I remember after she was revised, Dr. Shamey had me latch in his office,
Mm-hmm.
and it did feel better for that minute, but then like when I got home, like it didn't, and it went
Mm-hmm.
back to like razor blades and
Right.
awfulness, and
Like
so
toe curling pain.
yeah,
Like, yeah.
awful. So then I just continued to work with the lactation consultant and just wait until something magically else happened. Really.
Mm.
So yeah, I met with her 1 to 2 times a week, depending on my emotional state and me freaking out about God knows what.
Mm-hmm.
But then in that meantime, I had like horrible postpartum depression,
Mm-hmm.
which, as we all know, makes nothing better.
Mm-hmm.
So I was so obsessed about needing to breastfeed and my milk supply and how much I was pumping and how much she was getting and how frequently I was pumping, and like the fact that my plan didn't go the way it was supposed to was like devastating.
Yeah. Now, did you know that you were experiencing postpartum depression? This is an interesting question for somebody who is in the mental health field
Oh my
because
God.
so many
Right?
people don't realize that's what's happening. And for somebody, I'm a breastfeeding supporter, both a peer supporter and a professional supporter, and it's not within my scope to tell somebody you are experiencing postpartum depression. I cannot diagnose somebody.
Yeah.
But what I can say is, I really think you should seek out a mental health professional
Hmm.
because this sounds like it is really overwhelming for you. And it sounds like you could really be helped by getting some support that way. But so many people, it just becomes their normal that
Hmm.
they can't recognize that their normal is really hard. And it's beyond the normal new mom hard and into postpartum depression or postpartum anxiety. So, as a mental health professional, were you able to step out of your experience and recognize, oh man, this is worse than new mom hard? Or were you not?
No. And that's
Yeah.
what you kind of chuckle about is, geez,
Mm.
that's my specialty. You think a red flag would
No.
have popped up on my own end and be like, Jessica, you're not right. Not okay. No, it didn't even, which it's silly, but it's not silly. But
Right.
so yeah, I think I cried every day, most of
Mm.
the day, and I
Mm.
had tons of support. Like, my
Mhm.
father-in-law and mother-in-law were retired, they were over frequently, my husband's aunt was over frequently, my friends would come
Mhm.
pop in, like, I had my parents would come when they were out of work or on the weekends, so, like, I had all of this support. My husband was phenomenal, is phenomenal, and I just cried
Mm.
and cried, and the fact that now that I look back on it, my whole world was turned upside down. Like, I went from doing whatever I wanted to do, whenever I wanted to do, to leaving the hospital with an extra person with my baby,
Mhm.
and I can't do what I wanna do anymore,
And you're stuck to a pump.
and I'm attached to a damn pump.
Mhm.
Like, the sound of the pump will forever haunt me, and then I have this baby who just doesn't like to sleep. And so then I'm sleep deprived. And well, as we all are, my child really didn't like to sleep and not knowing why she was crying, just like the new mom stuff. And then all the hormonal things that happen postpartum. were crazy. And then it was really like when I talked to my husband about it, we both like firmly agree my postpartum was even exacerbated by the fact that I was not physically breastfeeding my daughter.
Mm-hmm.
I would have my I remember my other friend came to visit, and she's a therapist, and she brought me a whole container of Oreos, and she
Mm-hmm.
goes, "Jessica, I have never seen you like this. You are not okay. Like, you
Mm-hmm.
really should try to see somebody." And for
Mm-hmm.
her to be like, "Jessica, oh my God, like, you need help." I was like, "Oh my God." And then so when my husband got home and I'm like, "Yeah, my Laura said that I should probably see someone." And he goes, "Jessica, she's right.
Mm.
Like, you you're really not okay." And I'm like, "How did I not catch this myself? I'm a mental health counselor who specializes in maternal mental health." Oh my God.
When you're in the thick of it, it's so hard.
Yeah.
And at what point was this that your friend said, "Hey, you really need to see someone"?
Oh gosh. I would probably say a month in.
Okay. Man, what a good friend.
Yeah.
Because it's hard to tell somebody, "Hey,
You're not
you
okay.
you're not okay."
Yeah.
That's a really hard thing to do.
Yeah.
But to say it in a loving and supportive way with a whole container of Oreos
Yeah.
and to say it's okay. Sometimes a person needs permission
Yeah.
to seek help, and for somebody who you trusted both as a friend and as a professional, I'm sure, to say, "Hey, it's time." I'm sure that might have given you some permission.
Yeah. And I'm just thinking back to, I remember just and sitting on the sofa and just crying and like wishing in my head that I could just run away and not
Mhm.
come back, and
Mm.
feeling so much guilt and shame because I had those thoughts of, I just want to run away right now.
Yeah, which is what we call an intrusive thought. It's
Yeah.
not you, it's not yourself.
No.
Yeah. Yeah.
Ugh.
Oh my goodness. So what did you do once your friend said this and you realized and you told your partner? Did you
Yeah.
act on it right away?
No. One, it took me a while to accept the fact that I needed help outside of
Mhm.
my support system.
Mhm.
And then I knew that I needed to find someone who specialized in it. And I will say, out here, there's very few clinicians that specialize in it.
It's really hard. Yeah.
And so I found someone, and I made an appointment, and there was a wait list. So I think I had to wait a few weeks. But in the meantime, I was still trying to breastfeed, and I was going to figure it out, and it was going to happen. And I was trying all these different positions. And one day I was home with Zoe, and my husband was at work, and I'm like, "Okay, I'm just going to try this." So I was on the couch and I was side lying feeding her,
Mhm.
and she freaking latched, and it didn't
Wow.
hurt.
And was that the first time you had tried side lying or you had tried before but this time it worked?
I think it was the first time I tried.
Okay. And
And
how did you know about that position?
I think the lactation consultant said something to me about it, but I laugh because I have a very small chest and I'm like, there's
Mhm.
no way my baby can even probably reach me. So I kind of laughed at it. I was like, haha, that's not going to work. And then I remember my cousin came over and I was crying, and I'm like, how did you feed your babies? And she's in the middle of the night, like, I just side lie and feed them. And I'm like,
Mm.
okay. I'm like, okay, I'll give it a whirl. So I ended up trying, and Zoe latched, and oh, I could cry about it. I just cried full of joy.
And
And
it didn't hurt.
no, no. And my husband came home, and he walked through the door, and I was crying, and he's probably like, oh gosh, she's crying again.
There
And I
we
was
go
like,
again.
she latched. And he was like, what?
Uh-huh.
And I was so excited. So that's just how I fed her. And then I remember this distinctly. I don't know if it was the next day or a couple days after the successful latching. I woke up one morning and that fog I had when I was depressed, I physically felt it lift from me. Like, I so remember that instance. I woke up and this fog that was in my head lifted and I felt like a freaking brand new person. It was this insane feeling of, oh my God. Oh my God.
Wow.
Yes. Um,
There is a different hormonal response to a baby at your breast than to a pump. There is.
yeah.
And I love that we live in a day and age where we can make different choices. And it's important to be educated about what those choices mean biologically for us and for the baby. Wow.
Yeah. It was like an intense feeling. And it was like, and then at that point, then I'm like, I'm better now. Like, I knew I was better. And then,
And you
so
said this was within days of that latch?
yeah, I think it was like either the next day or 2 days. It was like pretty immediately.
And you, so from that latch, from that sidelying latch, you just began every feed sidelying position
Yeah.
for like a couple days.
Until I was able to go into other positions that became comfortable.
And you were doing that, you said the first one was on the couch. Okay. And did you find other places where you could do that sidelying position?
No, I was just either on the couch or in the bed.
On the couch or in the bed. Okay.
Yeah.
Wow. Wow, wow, wow. I started the Milk Making Minutes because I'm passionate about supporting breastfeeding people. But more importantly, I knew that hearing real people tell real stories would benefit both the storytellers and the listeners. I had this idea for 3 years before I launched. I asked so many people how I should begin, and Anchor came up repeatedly as the easiest way to launch a podcast. And I have not been disappointed. If you are passionate about a topic and have wanted to start a podcast, you can use Anchor to record and distribute your podcast. It's easy to use. You can use the editing tools right from the platform. You can distribute your podcast episodes seamlessly to listening platforms like Spotify and Apple Podcasts right from Anchor. And the best part is, it's free. And the tech support has been great too. Go to anchor.fm or download the app right to your phone to get started on your great podcast idea.
Yeah. So I went from exclusively pumping for 3 months, and then she finally latched at 3 months.
It was 3 months.
Yeah. 3 months of hell.
Wow.
Yeah. And then she latched at 3 months. So then I went straight to breastfeeding her. But then if me and my husband wanted to go out, she was still taking a bottle. And then at 6 months, she started refusing a bottle and only wanted my breast.
Also challenging.
Yes. So then once that happened, I didn't get depressed to the point I was before, but I felt for those 3 months I had this like freedom of I don't have to be hooked up to a pump. My daughter's taking a bottle. I can get my identity back and go out and do things. And then at the 6 month mark, she refused the bottle. And I felt like I was in prison again
Mm-hmm.
because I felt like my freedoms that I started to get back were then taken from me.
Mm.
Because I felt like me and my husband couldn't go out or we couldn't do an overnight or any of these things. And
Yeah.
then that led me to the dilemma of what do I do about work?
Jess described all the things they did to try to entice their daughter to take the bottle again. From trying every bottle on the planet to trying to feed frozen breast milk popsicles, nothing worked. She hoped that once solid foods were introduced, that baby Zoe would take to solids, and that would relieve some of the pressure to be with her daughter constantly. But as you will hear, that's not how it worked out.
While I was pregnant, I always thought after 3 months I'll go back to work. I'm like, there's no way I could be a stay-at-home mom. I can't do it. Then, then I had her, and then the 3-month mark came and I was a mess.
Mm.
So then I was working for myself. I had my own private practice. I didn't have to call into like my boss or HR and ask for FMLA or anything like that. But I was like, okay, let me wait till the 4-month mark. So the 4-month mark came. I'm feeling better. And I'm like, I'm not ready to go back to work. 5-month mark came. I'm still telling my clients, oh, I still need more time. And then I was just like, I can't go back to work. I cannot leave her.
Mm.
Like, I want to be home with her. And then the 6-month came and she refused a bottle. And I'm like, still toying with the fact of maybe I can do like part-time. And then she refused a bottle. And I go, how am I supposed to go back to work? I can't go back to work. And women ask me to this day, what did you do? How did you go back to work when your daughter refused a bottle? Because their child was refusing a bottle. So they're like, how do I go transition back to work? And I laugh and I'm like, I quit. I quit.
Oh,
I need
man.
to go back to work.
Mm-hmm.
I was like, what was I supposed to do? I don't know. So I quit.
Yeah.
But then I ended up going back to work when she, I think, was like 18 months old and was able to be away from me for longer. I went back to work like super duper part time.
Okay.
But yeah, that was a dilemma. What do I do?
Yeah, no kidding. And by that time, I'm sure some of your clients had moved on.
Yeah. Yep. I made other referrals and they were seeing other therapists. And then I only kept just a handful, I think a handful of
Hmm.
clients.
Okay. Okay. So it was part-time enough that you really didn't need to try to find new clients at
No,
that.
no,
Okay. You
no.
just kept the handful
Yeah.
that you were willing to take on at that time.
Mm-hmm.
Okay. So you mentioned that the fog lifted around that 3-month mark when you finally were able to have the breastfeeding experience that you wanted. Did any of your postpartum symptoms return once you realized you needed to adjust your life because of your situation? Or,
I would have like bouts of it when I felt restricted, especially with her not taking a bottle. I would have days where I would just cry because I felt like a prisoner within my own home, within my own body.
mm,
And my husband, as all men are, they try to fix problems. So he would always try to like brainstorm, how can we make this better for you? So yeah, I would say the first year was rough with that, but I got better. It became my normal. So I just learned how to cope with it.
yeah, and were there things that you did that did help make it feel less like coping and make it feel more like joyful? Were there things that you found that
I
you
wouldn't say joyful, but I knew that it was my mantra was this is temporary.
mm,
In it right now feels like the longest time ever,
mhm,
but when you look back at it, it's just going to be a small glimpse. Like it's just temporary. And that's what I
mm,
just kept saying to myself. Like,
mm,
Jessica, it's just temporary. It's okay. It's just temporary.
yeah,
So knowing there would be an end is very helpful. You
yeah,
know,
even
it
if it's eventually down the line.
it wasn't my forever, even though it felt
Yeah,
like forever.
but it is only temporary. Even if the temporary is for a long time. If you had told me that my 8.5-year-old would still be wanting me to lay down with him to sleep, I would not have believed you.
Yeah.
That's what he needs and wants. And if I were totally done with it, I would be doing something different. I'm
Yeah.
not. That's a parenting decision I'm making.
Yeah. And I will say too, I'm an avid softball player and I returned back to softball
Mm,
and that was very helpful because I got to be with other adults and do something fun and do something for myself every Sunday. And
yeah,
no, but knowing my daughter wasn't taking a bottle, my husband would always bring her to me and I would breastfeed her at the games.
that's great.
So
Yeah.
he's super awesome when it comes to that. And currently now, since I'm breastfeeding my son, no matter where I am, if I'm gone, if I need to be gone for the day, even though he does take a bottle, like he'll bring him to me. So my husband always has brought my kids to me to breastfeed.
Yeah.
Just
So
one.
prioritizing those things which did bring you joy that were not connected to your children. Yeah. Yeah. And you mentioned that your daughter was not the best sleeper. How did you make nights work for you?
She's still not the best sleeper.
Mhm.
We're still
Gotta cut
struggling
those
with that
out.
scenario 5
Yep.
years later. So she never slept in a crib. She co-slept, and I would just feed her whenever she woke up. She was the baby that woke every 45 minutes. Awful. And once, how old was she? When she was 8 months, we put a queen mattress on the floor next to our bed. And so every time she woke up, I would just roll out of my bed and fall onto the floor, breastfeed her, go
Mm.
back up to my bed,
Uh-huh.
roll back down, get back up, roll back down, get back
Oh
up.
my gosh. I haven't exactly heard that one before. I've heard lots of sleep scenarios, but I think that's a fantastic solution for somebody who doesn't quite want baby in the bed with them, feels not comfortable with that, but for whatever reason, co-sleeper doesn't work, doesn't want to use the crib. I think that's a great solution
Yeah,
to
threw the
that problem.
mattress on the floor and put it in
Yeah.
between the bed, our bed and the wall.
Hmm.
So she had all sides to her. But yeah, she was in our room like that until 18 months.
Yeah. And then you have a space too that you can lay down on for the
Yes.
feeding. Yeah.
Yes.
Yeah.
Yes.
You don't have to squeeze into some tiny little twin mattress or something.
No, no.
Yeah. Yeah. Now, you were a mental health counselor focusing on maternal mental health
Yep.
before you had your children.
Hmm.
Has this experience, the experience you had with your daughter, changed the way you practice or the way you view your clients?
I have much more empathy for them for sure. And in some scenarios, it's very helpful to know how they feel because I went through it too. And granted, everyone feels things differently, but yeah, just it helped with the empathy for sure. Of gosh, I know
Yeah,
how it feels. Ugh.
right.
So that was very helpful.
As we were wrapping up, Jess told me there was something else that happened with her experience nursing her first child that she wanted to talk about. And I'm so glad she brought it up. She brought up something that so few people talk about because when it comes to nursing our babies, we sometimes feel embarrassed to think that we might have an aversion to them touching us. Listen to what she had to say.
So I did want to, and I don't know, I did want to touch upon one thing with Zoe just because no one knows about it and it's never talked about.
Yeah.
Um, so I ended up breastfeeding Zoe for 2 years, 10 months.
Okay.
And towards the end of our journey, I I remember I would give her naps. We had a lazy boy recliner. I would give her naps in there, and she always needed to be held for naps and bedtime. Still does. And
Mm.
and I remember sitting in the recliner, was in her room, and it was next to the window. And I would always breastfeed her to sleep. And I remember she latched, and I had these awful sensations of my skin was itching, like I was crawling
Mm.
out of my skin, and I
Mm.
just needed her to urgently get off of me, but she was sleeping, so I didn't want to wake her up. So I had to like learn how to deal with it. And then I would get like really like irritable. It was like this horrendous feeling that came out of nowhere, came out of
Yeah.
nowhere.
Right.
I was like, "Oh, that's weird." What dealt with it. Last year, the next time, same thing happening, and it kept happening over and over again. And I didn't say anything to anybody because I didn't know what the hell was happening, and I didn't want people were just going to be like, "I don't know," or look at me
Mm.
like I had five heads.
Hmm.
And I remember, I think I said something to my husband, and I'm like, I can't breastfeed anymore. Like, we need to figure this out. It's an awful sensation. She just needs to get off of me. Like, I get super angry. And I remember
Mm,
one day, and this is just so awful, sitting in the recliner, and she fell asleep on my breast. And I was getting so angry, and I just wanted to throw her. And I remember taking my hand and putting it around her head and just wanting to squeeze her
mm,
head. And I remember, like, my hand was on her head, and the thought of squeezing it, I just wanted to squeeze her head like hard.
yeah, yeah.
And I was like cupping her head in my hand, and I freaked out, and I started to
Mm,
cry, and I go, "Something is
mm.
wrong." And I texted my
Oh,
husband, and I said, "You need to come home. I'm not okay."
oh no.
It was awful. It was the
Yeah,
worst.
I bet.
It felt like I wanted to hurt my child,
Yeah,
and I knew I wouldn't, but, like, I wanted to, and I'm like, "What the hell is happening?"
yeah.
So, I ended up Googling it, and come to
Hmm.
find out, it's a thing,
Yeah,
which is called breastfeeding aversion and agitation,
yeah.
that 1, didn't learn in breastfeeding class, 2, no one knows about it, and then 3, I was never taught that in my mental health class, my maternal mental health program I
Hmm.
attended. So it was like, what is happening to me? It was
Mm,
an awful, like, my husband came home, he had to, and it was just like this awful feeling. And so
yeah.
with that, we started to wean, and the weaning process, I don't even know. It took so long, but I had to deal with those emotions while she was latched onto me, and it was just horrendous.
Now, oh man, thank you so much for sharing the story because you're right. It is something that happens and people don't talk about it because they're scared to talk about it.
Mhm.
Because if you say, I had a feeling of wanting to hurt my child,
Oh, like you,
what does that mean for
yeah,
you as a parent
yeah,
and as a mother in particular? Mothers aren't supposed to have those feelings. And again, and I'm saying that in quotes, not that we're actually not supposed to have those feelings because
no,
that again is an intrusive thought that
yes.
can be hormonal. It's not actually what a person feels or thinks. But when you feel scared to tell anyone for fear of what the consequences might be, because you do dearly love your children and never want harm to befall them, you as an actual person, but fear what saying anything might do, then there's nowhere to get help,
Mhm,
especially if nobody actually knows about this phenomenon.
mhm,
If even mental health professionals are not trained on this phenomenon.
yeah,
Oh my gosh.
yeah.
So when you realized what this was, did you decide to slowly wean from breastfeeding in order to make it easier for your daughter and to make sure you didn't get clogged ducts and mastitis?
Yeah, we're already weaning. She was just breastfeeding here and there, and I would breastfeed her to sleep, and then that was
Mhm.
it. So it's we had to just the breastfeeding to sleep at night was like the hardest one to stop.
Okay.
Um,
Okay. And she
but
was so accustomed to that, to going to sleep, that it was
yeah,
hard to just suddenly have another plan.
yeah. But yeah, I remember. I think actually, honestly, like, this is the first time I talked to it to someone like that's not my husband. No one else knows that I experienced that because I didn't want people freaking out.
Yeah, of course.
And how can they A, relate, and B, help me if it's like a hormonal thing that's happening within my body?
Right.
But yeah, that was like super intense. And
Oh,
that,
I bet. And how long did that last? How long was the weaning?
oh, I think it was like 3 months of that horrible feeling.
Oh my gosh.
Yeah,
That's a long
that
time
is a
to
long.
be dealing with that every day at bedtime. And were you doing any pumping at the time?
No.
Okay. I'm just curious. Pumping would have brought the same sensation. I'm assuming no. but I don't know.
That's a great question.
Yeah.
I don't know.
Yeah, I've experienced intrusive thoughts having to do with PTSD, with not postpartum and breastfeeding, but just other things. And it's scary. You don't know who you can trust to tell.
Exactly.
Especially as a mother, I think we get judged more harshly and are expected to just not ever have them. I don't know.
I agree with
Yeah.
that.
hmm And we would do anything to protect our families. So if that means shoving it all inside and not saying anything, then that's the thing we do.
Yeah. Yeah.
Yeah.
So, yeah, our journey ended short of 3 years,
Wow.
which is a long time.
Yeah.
Yeah. And
Absolutely, especially with the start you had. For anybody, that's a long time, but to have started the way you did and then to go for that long, it's pretty amazing.
then I had my son last April,
hmm
and he latched phenomenally.
Oh my gosh.
It was
Were you scared leading up to it? Did you have anxiety?
I did. I had perinatal anxiety with him anyways, because previous to that, my husband and I miscarried. But we, knowing my postpartum with Zoe, we over planned for him.
Mhm.
And I ended up, this time around, my parents were both retired, so that was very helpful. And then I had postpartum doulas come in and help me.
Oh, great.
Postpartum doulas in general are just wonderful beings. And I remember with Luke, the first week of feeding was phenomenal. It was so easy. But I remember freaking out of what if it doesn't go well, and what if I have bad postpartum like with Zoe.
Mm,
But it wasn't the case. And then after the first week with Luke, my nipples started to get irritated
mm,
because he ended up having ties too. And I immediately, like, the postpartum was so bad that it was traumatic. So when my nipples started getting super irritated and he wasn't latching after that week, latching correctly, he was still latching.
mhm.
I went straight back to when I was trying to breastfeed with Zoe, and I was just like crying, and I was calling my home birth midwife, and I'm just like, I can't go down this road again. Oh my god, like my nipples. And she talked me through it. And
Mm,
so we gave him an SNS line and a syringe for a week,
mm.
and then my nipples healed, and then no issues from there, thank god.
Okay,
So we're still happily breastfeeding today.
great. Awesome. Yeah, it doesn't always happen that way, or the second is so much easier, but I'm so glad, given all you went through, that it was for you.
Yeah.
Yeah, thank you so much, Jess. Really appreciate you taking the time to share your story and being so vulnerable about so much that you went through, not only the physical struggles with breastfeeding, but also the mental health struggles, because those are the things that people are afraid to talk about, as you mentioned. And they're also the things we need to talk about so
Yes.
that people don't feel alone
Yes.
and they know that they're normal and that it can be a part of their experience and that there's a reason for it. And that even if their providers aren't educated, if they know there's a name for it, they can look it up and educate their providers so that they have a way to talk about it.
Yes.
Yeah.
Yeah.
Yeah, so thank you so much. If people want to connect with you, is there a way that they can do that?
Yeah. They can email me. I don't know if you could put up the email link somewhere.
Yeah, I can do that in the show notes.
My work email is Jessica Pettit, LMHC, licensed mental health counselor, at gmail.com.
Awesome. Okay, great. We'll put that in the show notes. Thank you so much.
Fabulous. Thank you.
I feel so grateful to Jess, who shared her story of breastfeeding struggle and eventual triumph and of severe postpartum depression tied to breastfeeding difficulty. If you are experiencing postpartum depression or anxiety, you can get help by reaching out to Postpartum Support International, linked on the show notes. You don't have to suffer alone. For a group of people who get it, to provide support and cheer you on, check out the Milk Making Minutes Keep the Conversation Going Facebook group, where I will be your #1 fan. If you would like more individualized lactation support, you can find me at quabbinbirthservices.com. Please rate and review the show in Apple Podcasts or on Spotify or your preferred podcast listening app, and share with someone who could benefit from hearing the show.